First, we're going to look at some testing for upper cervical instability. So I'm going to have my patient start for these tests in supine. One, they are more relaxed and I have better control of their head. And two, if there are any symptom provocations, that patient is already laying down, it's a little easier to deal with those. So the first test I'm going to do is the alar ligament test, followed by the sharp purser, and then the transverse anterior shear test. So I do the transverse anterior shear last because it is symptom provoking, and I kind of want to see how the other ones play out before I go for the most provocative one. So for your alar ligament test, you're testing at lanoaxial rotation. So what I'm going to do is I'm going to stabilize the C2 spinous process with the pincer grip. So I'm going to feel down from the occiput and stabilize that C2. And with my other hand, I'm going to induce just a little bit of flexion, and then I'm going to side bend away, and I will feel for that C2 to kind of pop into my right, the right side. Alternately, if I'm testing the left, I'm going to side bend to the right and feel for it popping into my hand. You can also do the same assessment with a little bit of rotation. So I'm going to induce flexion, rotate away, rotate away. For the sharp purser, I'm again going to use a really solid grasp on the C2 spinous process to stabilize my patient. I'm going to use my hand to induce a little bit of upper cervical flexion, stabilize that C2 spinous process really well, and then I'm just going to direct a straight posterior push. And what we're feeling for is symptom relief of any of their nausea, dizziness, or excessive movement or a clunk. Finally, I'm going to do the opposite. I'm going to get on the C1 transverse process, stabilize that really well, induce a little bit of a flexion, and then I'm going to, with this hand, move the C2 spinous process anteriorly. And for this, you're going to push that dens into the spinal area, so you will have symptom provocation with this one. I'm just going to push anterior, check in with my patient. How you doing?
Good.
Good. All right, next I'm going to have the patient come to sitting. And we are going to assess the same things. So for the alar ligament, I'm going to get down on C2 spinous process, get good stable control with their head, and as I really flex away, I'm feeling for it to pop into my hand. There shouldn't be a lot of motion before you feel it start to pop into your finger. Again, with the rotation away. With the sharp purser, I'm going to stabilize C2 really, really well, induce a little bit of upper cervical flexion, and then direct that posterior force. Finally, I'm going to stabilize the upper cervical C0, C1, and then with my hand on C2, apply a little bit of an anterior force. That was how I test upper cervical instability.